I'm Patricia Stuart. I'm a GP and I've been involved with training doctors for quite some time. One of the things I'd like to make sure is that junior doctors that are going to do rural relieving really know what they're going to do and really understand the experience and get the most out of it. To do this, I think they need to be prepared. They need to find out where they're going and then Google it. Find out where it is, what goes on there. Find out as much as they can. And then try and find out if there's been other junior doctors that have gone to that town, what their experiences are. Then when they finally get there, they need to make sure they've got a really good orientation. Hopefully, the centre, or wherever they're going, will provide that for them. But if it doesn't, they need to be very proactive and really make sure they find out what goes on in that hospital, where things are stored, what happens, so that if they're on for the first time and some kid comes in with an allergic reaction and can't breathe, where are the tubes, where's the adrenaline, where is everything kept, so that they're not running and racing and panicking to try and care for somebody. They also need to be really orientated to the town. What happens in that town? What goes on? What makes that town tick? Talk to the locals and become part of that community. Their experience will be much more enjoyable, and they'll probably find, if they're willing to be part of the community, that the community will ask them to do things with them. Go fishing, go out to the weir, go water skiing, whatever goes on, go to the races. And then the other important thing is not only the general community, but the community at the hospital. They have to learn to relate to everybody in the rural hospital and not be the doctor. The people that work in that hospital have been working there for a long time. They know their community and they know what to expect. So if the doctors respect them and understand their role, then it'll be a much better experience for them, for the patients, and for all of the staff. So I think rural relievers really need to be prepared and not to be frightened, but to be quite excited about what they can learn in a rural area. And if they're prepared, it can be a great experience.